All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. It helps, these exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
Times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So
Indeed.
Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Hello, everyone. You are listening to the GynoCast. My name is Dr. Eric Heegaard. I am, believe it or not, a board-certified obstetrician gynecologist. I'm sitting here with Twila Dang. I'm not even going to let you. I'm not going to even
You're
let
not.
you introduce yourself.
I just want to know why you said believe it or not.
I don't know.
Because if somebody's listening for the first time, they're going to be like, credentials?
Well, because I'm going to start out with a joke.
Okay.
So, actually, does our guest? We have a guest today. I'm going to introduce the topic in just a second, but we have a guest who's now a veteran on the GynoCast. Dr. Matt Bigus from OBGYN West. Welcome.
Hello. Thank you very
Why are
much
you
for having me. I
clapping?
appreciate it.
Clapping because
If you want applause, just tell me. I'll add it in later.
well, we want just raving applause. Anyway, Dr. Bigus, it's nice to have you back.
Well, thank you for having me again. I appreciate it.
Dr. Bigus is our newest member at OBGYN West, which, for those of you who don't know, is the best group in terms of obstetrics and gynecology in the universe.
Absolutely.
In the
Without
universe.
a doubt. In the universe.
Okay.
And so, for those of people who don't, well, first of all, let me just say this. If you're new to listening to the GynoCast, welcome aboard. Thank you for tuning in.
Yeah.
It means a lot to us that
It
you will
does.
spend 4 hours listening to this
Okay,
podcast.
stop
I'm just
that.
kidding. It's 30 minutes, 30, 40 minutes.
30, 40 minutes tops.
Listening to us, if you are a repeat listener, we love you as much and differently.
Why does it have to be differently?
Well, because it's like if you have 2 kids, you
You're
don't
doing
want
the most today.
you
I
know,
don't tell. Yeah, let's see how that goes. I go home and tell
Who
my
do you
children,
love
I
the
love
most?
you. I love you both the most, but differently.
Well,
yeah.
it's like I love you the bluest.
Oh my gosh, that's
I
gonna
love you
be
the
that's a
greenest.
migraine waiting to happen when you watch 2 kids follow you around all night and go, "How's it different? How's it different?"
But we appreciate our listeners in different ways, but
No, I don't. I
equally
appreciate
and-
them all the same.
But a new listener is silver.
Oh my
And an
goodness.
old listener is gold.
And you love them.
One is
you love
silver.
them longer.
I love them
Longer.
Dr. Bigus jumps
No,
in with the
none of you are doing well with this. None
One
of you.
is silver and the other gold.
Okay.
Okay,
No, I
so-
just appreciate every single person who tunes in for whatever reason, whether you're returning, whether you're brand new. All of your support is greatly appreciated.
That's right.
Thank you.
So, what do we do here on the GynoCast, Twila Dang?
We
What
talk about
do we do?
We talk about anything and everything women's emotional and physical health and well-being.
That's right. And it's a wide net.
Yes, it is.
It's a broad brush.
Sure.
A huge swath.
Okay.
That can cover just about anything, but it touches on the lives of women in some way. And we like to talk about things that people really need to know about and want to know about, but sometimes don't know where to go. And the things that anybody can talk about. What an ingrown toenail. Anybody can talk about that. You could be sitting with I bet you could be sitting next to the president and be like, "Wow, have you ever had an ingrown toenail, President Trump?" Yeah. It's like you could say that at state dinner. But the things we talk about, and the things we talk about on the GynoCast, you probably don't want to talk to President Trump about.
Yeah, I
Or
do.
Melania,
Yeah, I do.
the First Lady.
Okay, never mind. Not doing that.
Okay, so anyway, where do you go? You go to the GynoCast. Do you
Yeah.
Google? No, you GynoCast.
Don't. Okay.
That's
we
where
talked
you
about
go.
that. Putting that O in the end.
That's right.
Stop.
And so we're going to jump into this. I thought we'd lighten it up a little bit.
Sure.
And it's light, but it's important. Dr. Bigus and I are obstetrician gynecologists. And, as we're going to switch kind of to the obstetrics aspect of things. And, when women are pregnant, it is a massive change on their bodies.
Yeah, tell me about it.
Absolutely incredible.
And they come in and they're the things that we don't worry, Dr. Bigus, I'm going to let you talk in a second. He's our guest, but you know what? I'm just saying, women come in and when they're pregnant, they have all these weird symptoms.
Oh, absolutely.
And I actually have a category, since I've been doing this longer than you, Dr. Bigus, weird sensations of pregnancy. And so I want to talk about some of these weird sensations and some of the symptoms and signs that are not necessarily so weird, but happen. And so Dr. Bigus has brought his broad muscular shoulders in, his keen mind, his razor wit.
I know. I was like, where was he going with that?
And so I'm gonna just pepper him with questions.
All right.
And but you're probably thinking to yourself, huh? Who cares, right? I'm not pregnant.
No, people care. If you're listening, you care.
But some of these things are funny and some are a little scary, but they're universally interesting. So
Well, I'll be the judge of that. 'Cause I've been through this before.
One of the things that we're gonna jump into, for example, is issues with the bowels. So, and maybe we should start up.
I thought you said this was going to be light.
This is okay. Let me just tell you this. But this is something that happened to me one time. A question. This couple comes in and they were East Indian. Delightful, right? Delightful people. And the woman, I can't remember. She's maybe 35 weeks well into it, and she's like, and she's very soft spoken. She's like, I just got to say that, I'm passing a lot of gas. And it's really smelly.
Oh, well.
And so, and how do you respond to that? And I look at the husband, who was a funny guy, and he just cracks up, nods his head, and he goes, "Oh yes, very, very, very bad, very bad."
Well,
and so, what do you say to that?
Well, you know what you say to that? You say to that, "It's all right, honey. You are growing a human being."
No, I know, but I'm just saying that when somebody, you look at the husband and he just nods his head, very bad.
You're supposed to pull him aside and go, "Sir, it doesn't matter what it is or what she says. All you say is you're amazing. Thank you.
You are amazing."
Thank you.
Well, no, I don't think this is meant to imply anything but I'm just saying that, there are things that happen.
There's a lot of awkward that goes on.
So let me
when
ask
you're
you this,
pregnant.
Twila. You go to a cocktail party and you just say, "Wow, I'm passing a lot of gas and it smells really bad this week." Is that something you do? Is that something you talk about?
No, but people ask me that all the time now.
What?
Like they'll come talk to me at a party and be like, "I'm having this issue."
Yeah, but they talk about gas passing.
Sometimes.
Breaking wind.
Well, remember, I eat differently than most people now, so I think half the time people are just looking for me to give them a little insight.
For God's sake.
I
Dr.
didn't
Bigus,
bring it up.
Twila is a vegan.
I am.
Oh, man. And probably your gas is now...
Listen, I'm
fine.
It's like I'm a toned and honed machine.
Your microbiome is just fantastic.
I'm fantastic. I'm
Twila
going to live to 150.
Twila and I are all about microbiomes now. Okay, but let's
we're very Gwyneth Paltrow at the moment.
Right. Okay, so Bigus,
yes.
You ready for this?
Here we go.
So let's talk about. Okay, I'm gonna put some structure to this. You ready?
You are.
First trimester. So a woman is just finds out she's pregnant, or she maybe doesn't know she's pregnant, but she's thinking. What are some of the things that a woman might notice about her body?
Well, there's multiple changes, but the biggest one that most people have issues with in the first trimester is going to be nausea and vomiting.
Ding, ding, ding.
Actually, it's probably the number one reason why we see patients, or even let alone have to admit them during labor or during their pregnancy, is for that nausea and vomiting of the first trimester. It's
not fun.
Oh, not at all. And really what's going on is it's their body starting to change and change the physiology. A pregnant woman goes through some massive changes throughout 9 months that puts their body into a whole new state, which is almost completely different from someone who's not pregnant.
Is she like a butterfly emerging from a chrysalis?
Sure.
Sorry.
Go ahead. It just came to mind.
Okay, radio's. When we used to do radio, we used to say it's not a visual medium. Neither is podcasting, so nobody can see you make the little butterfly wings with your fingers and then jazz hands to emphasize.
So like a different animal.
Absolutely, which is why you take that medical book of physiology that you get in med school and you can throw it out the window when it comes to pregnancy because everything changes. And it's all because of three things, really. The first being the pregnancy hormone, HCG. The second
Human
being
chorionic gonadotropin.
Absolutely. And
Indeed.
The second being progesterone. And the third being estrogen.
Yeah.
All three of these in pregnancy skyrocket in a woman who is not used to this and their body has not undergone those changes before. And those three things are going to be the primary cause of all of these weird symptoms that they're going to get throughout their entire pregnancy. So the first trimester.
Don't you love this? I'm just saying, look, he's done what we always try to do on the GynoCast, which is there's lumpers and there's splitters, right? He has taken a complex universe and put it into three things that we can understand. Thank you, Dr. Bigus. Continue.
It makes it easier for me to remember. So you take these things, and basically what happens in the first trimester is the first thing really that elevates in a woman is going to be her human chorionic gonadotropin, or the pregnancy hormone.
So that's what we test for when you get a pregnancy test.
Absolutely.
You're testing for HCG.
Because when you buy that off the shelf at either the dollar store or the fancy ones at Rite Aid, whichever ones you get, and you pee on the stick and it comes back with the two little lines or the happy face or the you're pregnant symbol, it's all testing for that pregnancy hormone in your urine, which gets excreted in there too. That pregnancy hormone, as it starts to skyrocket up throughout the first trimester, it crosses over with some of the other hormones that you have in your body and starts to give you some nausea. And that's going to increase, and that's going to start increasing other things in your body like that progesterone. And the combination of the two is going to really start changing your stomach a little bit and causing you that nausea, which is probably the number one reason, besides your missed period, that women know that they're pregnant. So they get that nausea, and they come and they see us, and they're like, what in the world can I do to kind of keep something down? And there's a lot of different steps to take. We start usually very conservatively, and we talk about small, frequent meals, bland foods, try to stay away from, I guess I'm new to Minnesota, so cheese curds. I've learned that really...
Yeah, it's a gut bomb.
Yeah, between
That'll
the
make you
fried and
gassy.
the ketchup and the fun.
That'll make you gassy.
Oh, yeah. So you try to stay with bland foods, small, frequent meals, about maybe the size of what you can put in your palm of your hand, eat maybe 5 to 6 times a day, and try to get your food in that way. Now, pregnant women will tell you there's a certain food that they can tolerate and most foods that they can't. In that first trimester when things are bad, just eat whatever you can tolerate. Get it down, keep it down.
So don't worry that you're going to become malnourished or you're going to starve to death.
No, you'll make up for it. I lost 20 pounds the first
20 pounds?
4 months of every pregnancy.
That's not normal.
That's
wasn't.
a little much.
Bigus,
That's a little much.
I had nausea through the first 6 or 7 months of every pregnancy consistently.
You can't. Listeners, you cannot listen to what Twila
That's on the
just
far
said.
end of the bell curve.
I'm not normal. Admittedly, I was not normal. I suffered. I wound up having to go on medication, and I really had a hard time. And my babies came out fine. We were good, but I had a really rough time. I thought it was the funny part to me was when you identified nausea as a symptom, and you said some people come in and they say they have nausea, and you help advise them. My very first doctor, which was the first doctor I ever fired, and we've talked before.
Twila's a tough sell.
Yeah, we've talked before about
She's a
how
tough
you need
customer.
to take your own. It's your health, and you're allowed to sort of be in charge of it. And if your doctor's not serving you, you can go get another doctor.
Absolutely.
That I had my very first OBGYN who. This was my first experience with one, first pregnancy, tell me that most of the time morning sickness is in your head and you can get over it.
Oh boy.
And mind you, this is after I've already spent a few weeks barfing 14 hours a day. And then I had to yell at my husband and yell at him and say, if somebody doesn't give me drugs, I'm going to hurt everybody. And then they did. But it was,
everyone was happy.
Yeah. But it can be, that can be very jarring. And then I guess I had a bit of a side question for you. Mm-hmm. I've noticed I've had some friends that were pregnant, and that morning sickness for them was no more than that feeling of butterflies in their stomach. And there's people like me that were, like a step under hyperemesis. Mm-hmm. So what is is there?
There is totally a bell curve, and it's how well people tolerate that progesterone increase and that HCG, the pregnancy hormone increase. Some people tolerate it better, some people don't. It's kind of the same as any other medical condition or experience that you might have, that some people can tolerate things better than others. For example, some people do a roller coaster and do great and they love it. Some people get on a roller coaster and hurl at the sight of it. And it's kind of the same
use
idea.
the word hurl.
Hurl.
I said barf 5 seconds ago,
Yeah.
so it's fine.
Our doctor just used the word hurl.
Hey, he's a professional. That's a professional term.
Sorry.
It's fine.
Emesis.
I like hurl
Yeah.
better.
Yeah, so do I.
You hurl.
So yes, there's totally a variable expression of this in different people, and that's sort of why we kind of start from the lower end of the conservative aspect of treatment and work our way up to the medications. If the small, frequent, bland meals don't work for you and you're still getting it, then the next thing I always recommend trying as a natural supplement is ginger chews.
Oh, yeah.
So those ginger chews, for a lot of people with just very mild nausea and vomiting, really start to work. And it's once you're trying those and you're trying the conservative methods, those aren't working, that's when we start to introduce some medications. Most of the medications that we use are over the counter. You can get them. The number one medication that we use is something called Diclegis. Can I use a trade name?
Yeah.
Okay. That is a combination of 2 over-the-counter medications, which is the only Category A or proven to be safe drug in pregnancy. And it really helps women kind of manage that nausea. Now, granted, there's women on that far end of the spectrum who, with some simple over-the-counter medication, can't quite control their nausea, and that's when we start to intervene with different other medications that are prescription, as well as, God forbid, if we have to admit them for hydration or so on and so forth. So there is a spectrum, and that's why it's important to kind of let us know what's going on, and sort of we can determine what is the range of normal, what to be expected, and hopefully most of it should resolve somewhere around 14 weeks or so. Kind of at the end of that first trimester is when the majority of nausea and vomiting pregnancy starts to improve or resolve for patients.
How about fatigue? I've noticed that most early pregnant women feel very tired.
Yeah, sleeping is good.
It is good.
Like that, yeah, at that point, in the beginning, you can't sleep enough.
Mm-hmm.
Why is that, doctor?
Well, fatigue.
Why, doctor?
Fatigue is very common all throughout the pregnancy. It starts in the first trimester and it gets progressively worse as you go on, but the mechanism changes a little bit as far as the level of fatigue. The first trimester, it is due to that increase of that progesterone. It just changes the way that you are perceiving the energy that you're conserving, and just your overall level of energy that you have sort of decreases in that first trimester. Part of that reasoning is your thyroid is changing as well, which is kind of the gland that sits in your neck that sort of changes your overall metabolism rate. And as those things change, you start to experience some fatigue with the pregnancy. You're starting to devote more and more energy to your uterus, the growing fetus, and improving that. Now, as time goes on, you're getting into the end of the second and third trimester. Your fatigue is usually more due to what we call physiological anemia of pregnancy, which is basically a normal low blood count in pregnancy. Now, this is a normal...
Dr. Bigus is taking his glasses off and rolling up his sleeves. He's getting down to business here.
So this is a normal phenomenon of pregnancy, that your body is getting ready for the end of pregnancy when you need to deliver a baby. In order to do that, you're going to lose blood, and your body knows this. So what it does is it starts to store up extra blood volume, and extra red blood cells. The way that your body works is it stores up more blood volume than the actual red blood cells that carry the oxygen in your blood. And because of this, if you think that you have, well, let's use an analogy of Kool-Aid. If you normally have a gallon of Kool-Aid, and now you're going to, maybe double that to 2 gallons, but you only add in half the mix of the second Kool-Aid, it's going to be much more dilute.
Yep.
So that physiological anemia that women get is often a cause of fatigue in the second half of the pregnancy. And because of that, that's why we recommend continuing taking those prenatal vitamins, because they have iron in them throughout your entire pregnancy. And if your anemia is starting to get a little more severe, you're going to have to start iron supplementation as well. We usually test for this at the end of the second trimester, beginning of the third, in order to make sure that you're appropriately changing for the end of pregnancy.
Okay, did he tell you that? Did he, like, I feel like...
No, he's just...
I feel like you're all just, like, looking at my medical record and going over all the stuff that I had to do.
Well, that's how common it is. Everybody experiences these things.
Yeah, I had to stay in the hospital for 3 days after my son was born. My iron was so low, they were afraid to let me leave. Because This is
the most common thing that happens to patients throughout. In fact, it's something that not a lot of people talk about, but it's so common that every pregnant woman has questions about this. And they come in, especially first-time moms, and they ask all these questions. And I hear it over and over and over again. And I'm more than happy to kind of sit down and go over all these things and have them sort of understand those changes going on with their body. It kind of helps some people process their pregnancy a little bit better and sort of understand the aches and pains that they're going through and tolerate them a little bit better, especially if they know that it is normal and healthy to experience this.
I have a quick question. So a lot of these symptoms are typically things that you see in women that are pregnant, you know, whether it's first, second, third, I mean, this is something you go through. Does it change if you're having multiple babies?
It's totally worse. Absolutely.
If one is bad,
two
is worse.
I mean, but I feel like because a lot of people now, especially when we've done shows in the past about infertility, about prolonging, starting your family until you're at a later age, and a lot of times we're seeing people that are having multiple births as their first birth.
Yeah.
So I'm just wondering, like, I say all the time, thank heavens I had them in an order, but not all at the same time, because I don't think I would have been able to take it.
All right. Well, twins. So twins is basically the same thing times two, because you now have two babies, usually two placentas. Two placentas make twice as much pregnancy level, so it goes up quicker. Your hormones go up faster. You experience more nausea because of that increased change. You have two babies now drawing iron from your body as well, as opposed to just one. So you really start to get more anemic and quicker in the pregnancy as well. And everything else that we're going to touch on shortly is usually just the same, much worse in twins, but for the most part, usually tolerated as long as you're eating healthy, you're doing light exercise throughout the pregnancy, and trying to keep healthy lifestyle behaviors throughout.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
Okay. So you were talking about physiologic anemia. Can you tell us a little bit about what is happening in terms of the heart and cardiac output, and the amount of fluid that? And you were talking
Absolutely.
about, there's some incredible in terms of the heart and the lungs, and physiologic changes that are very impactful.
All right, so let's start with the heart. So in order for your body to support the pregnancy, you now have a new growing fetus, a placenta to perfuse, or to supply blood to, that you didn't have before. It's a lot extra blood that you need to pump through your system. In order to do that, your heart has to work harder. In order to make your heart work harder, women are going to start to have a faster heart rate, because a faster heart rate is going to increase how much blood that they're pushing out of their heart, or the pump of their body. And in addition, they're going to squeeze just a little bit harder throughout. Their vessels throughout their whole body are going to relax. When those vessels relax, that allows the blood to move more freely throughout and increase the blood supply to the uterus as well. And that's going to be one of the other issues that women find in pregnancy, is their legs start to swell.
Mm-hmm.
And a lot of women will come in and they'll say, oh my gosh, look at my hands, look at my feet. My rings don't fit. I can't put my feet in my shoes. God forbid I put on sandals. I look like I have these big puffy marshmallow feet.
Yeah.
It's true.
I'm not gonna lie. I broke a pair of sandals
You
2
ever
days
seen-
before my baby was due.
Mhm.
I was walking, and both of the sandals literally gave out and said no more, and they just split open, and I had no shoes to walk home with.
Anybody who's been pregnant knows this. You get farther along in pregnancy, and their feet are just like bursting.
Yeah, you look like your elephant. trunks.
Absolutely. And you always know that the doctors usually look for it, ask about it, and ask how your swelling of your feet and your hands are. And that swelling is really due to its effect of the progesterone that we previously talked about. That progesterone decreases that elasticity or compliance of your vessels, so they relax, like I said. When your vessels relax, they get a little bit more leaky, meaning that there's little windows in the vessels that allow fluid to kind of transport back and forth. As the vessels relax, those windows get bigger, the fluid leaks out, and actually gets harder to get them back in. And that's kind of the reason why you can use gravity to help your feet decrease the amount of swelling, which is why we tell women after like a long day at work or out walking around, go sit down, put your feet up on the sofa, have your husband rub your feet, try to get that swelling down, let gravity do the work for you, raise them above the level of your heart, and that fluid will kind of slowly work its way out of your legs and kind of back into your circulatory system.
So swelling, even quite a bit of swelling, is normal.
Yes, it is.
And then how long does it take for that to go away after? Because women don't continue to be swollen for the rest of their lives. It goes away after delivery. How long does it generally take?
So interesting, because usually right after delivery, women get worse. The first couple days, they're like, oh my gosh, I'm going to have the baby. Things are going to get so much better. First couple days afterwards, their swelling is usually so much worse than it's been throughout the rest of the pregnancy. And after that, it usually takes a couple weeks, 2, 3, 4 weeks, sometimes up to 6.
And then they just start peeing it out.
Oh, absolutely. Yep.
Okay, thanks for the sound effects. I don't think we necessarily needed the sound effects, but thank you.
We're not terribly sophisticated in terms of our special effects here. But
We are. It's just somebody
gosh.
keeps forgetting that we are, and instead of asking for it, he just keeps making them. So we can stop that.
Okay, so swelling and bloating, very common. So how about skin changes?
Oh yeah, talk about that.
So skin changes, those are going to go right along with that progesterone effect. You're going to have some darkening and pigmentation of the skin. It's actually really interesting. There's a very unique phenomenon that's called, it's this pregnancy mass that you get. And you start to get a lot of darkened freckles across your face. And that often is very concerning to women because it sort of changes your appearance a little bit. And your face looks a little bit different. Now it's darker with all these freckles that you didn't have before. In addition, you can get a dark line right down the middle of your belly that changes along with the stretch marks that occur across your abdomen as your belly gets larger to accommodate the growing uterus.
Yep. I use those stretch marks as an excuse for the rest of my life to get out of any and all things. If my husband says, you can help with the yard, I go, I've got stretch marks. But when my kids say, but Mom, why do I have to do dishes today? I go, but I've got stretch marks. And I just use it for, it's now my blanket statement.
Yep. And those are all very, very common things that change in pregnancy. And unfortunately, not everybody afterwards will some of those skin changes resolve. Most of them will, but some of them will not. You may have a darkened line down your abdomen that sort of persists after delivery. But for the most part, most of it does fade away. Some women like to try cocoa butter on their stretch marks. If there's actually something that 100% worked, I would tell you what it is. But unfortunately, there's not really anything out there that's been proven to get rid of those stretch marks.
Can't you just say, like, I guess that the one thing I wish I had done differently is instead, I kind of gave up. Like, you get to a point of discomfort where you just give up trying to do anything on your own behalf. I would just say to partners out there, not even to the pregnant women, but to their partners, don't let them give up or take over that for them. Like if it was something like keeping the skin moisturized and stuff, help them do that constantly, because I think that can kind of help take away how bad some of them get, because you wind up. I mean, I think some. I don't know. I mean, some of it's really just genetic. I mean, like in my family, it's genetic. We knew we were going to get them. I knew they were going to be bad, but I feel like maybe if I had not quite given up, maybe they wouldn't have been so bad. I don't know for sure that, I mean, that medically, I'm only speaking as like a person who wishes they had done a little bit more self-care, and maybe I'd have felt better about the result.
Well, I think, okay, just Bigus, tell me if I'm saying this right, but the way I think about the skin is you have the layers and layers of skin cells sitting on top of this connective tissue hammock. And that hammock, that connective tissue is not very stretchy. And so as the skin gets distended as the pregnancy grows, that thing will crack or split. And so you can moisturize the hell out of your skin. You're not going to moisturize that layer, that connective tissue layer.
Mm-hmm.
So do you think a better approach is to maybe like really make sure you're doing the best that you can do sort of nutritionally to sort of contain the amount of weight?
You got to choose your parents carefully. and you got to try to Dr. Bigus, just tell me if I'm totally off here, because I'm just winging it here a little bit. But mostly genetic, but also it depends a little bit on how fast and distended the skin gets.
Absolutely.
You agree with that?
Exactly.
Oh, so if you're having more than one baby,
yep.
Sorry.
Mm-hmm.
Yeah.
Twins is going to have a lot more stretch marks. But stretch marks are so common that they have their own name in pregnancy called striae. We use that all the time, and it's something that's just very common. Unfortunately, it can be cosmetically not as appealing, but you had a child, and it's perfectly normal and healthy to have stretch marks like that.
I'm telling you, should be. You should just carry a card in your wallet that says, "I had children. I've got stretch marks.
That's
I had
right.
children, and that's it, and no other explanation."
Absolutely,
that's right. So sometimes nipples get darker.
Yep.
So for people who are panicking about their nipples, and that's what causes that, doctor? I'm just why, doctor? Why?
Oh, it's the same. It's sort of the same thing that changes the face, changes that line across the abdomen. It's that progesterone change. It's your breasts are starting to develop as well to begin the lactation process. You're increasing those mammary glands. Your nipples are getting ready to breastfeed, and things are changing a little bit. You're going to get some glands that are a little bit more prominent right on the nipple or the areola itself. And those are all very, very common things in pregnancy. Nothing to worry about.
And some people get acne, too. They get...
Yep.
Twila, you must have just been like a walking...
Listen, I was miserable. And if you ask my children right now, hey, should mom have another baby? Before you can finish the sentence, they all go, no. Absolutely not.
So that leads me to another thing. In terms of kind of emotional different changes, in terms of what are some of the things that women may experience in terms of pregnancy? And
sure. So emotionally, the thing that we worry about is when women start to get emotional changes that are starting to borderline on depression, anxiety, and especially worsening of previous psychiatric issues that they may have had before. Yeah. And it's something that we like to keep a close eye on. It's very important to make sure you tell your doctor if you've had issues with depression, anxiety in the past, because in pregnancy, they are much, much, much more likely to recur. Even if everything is perfect for you and you have no stressors in your life, which you may have had before, just by having a diagnosis of depression that's been treated before or not treated, depending on your situation, you're more likely to recur in that, which is part of it's more of a chemical change. It's not really an emotional issue. It's never your fault when you have these depressive thoughts and sort of things are changing a little bit for you. It is some of those changes in pregnancy. And actually the most concerning time is not necessarily before, but after. After you deliver the baby, when your body is sort of reversing those changes even more rapidly than previous, you're going to get what's called the baby blues. Almost a good percent, 2/3 or so of women will experience the baby blues, which is sort of a short, self-limiting period of time where they start to feel sad, overwhelmed, despite their brand new baby, healthy as can be. And it's normal. It's normal to have those feelings, but what you want to be mindful of is if they don't go away in about a week to 2 weeks period of time. If they're persisting and they're getting worse, you ever start thinking about hurting yourself, hurting others, hurting the baby, you need to call us, let us know right away, because that is a medical condition that we need to see you for and probably start you on some type of treatment.
So let's go back from the beginning of this podcast. I was talking about the gas that smelled very, very, very bad.
Okay. We know.
So what's going on with the bowels, Dr. Bigus? What's going on with the bowels?
Bowels change just as well. Actually, some women will go through periods of constipation and then switch over to periods of diarrhea and flip-flop back and forth throughout the pregnancy. More commonly, it's that the bowels slow down. Yet again, progesterone, our friend, and I guess enemy, causes the bowels to slow down. It's a natural phenomenon of pregnancy that actually, in developmental sense, allows the food to pass slower, so you can achieve and absorb more nutrients out of that food to provide for the baby and yourself. And because your bowels sort of slow down with how fast that they move along, that causes usually constipation. That'll cause some odorous flatulence.
And
I just love that word. Who came up with that?
Oh, no.
It's like eructation.
I don't know what that word is either, but apparently you enjoy it.
Burping.
Is that what it's called?
Oh,
Yeah.
Really?
Yeah.
I learn something new every day.
It's like freterism.
I don't know what that is either. How can we not say, don't be putting stuff out there that makes me have an MA on this.
Freterism, I'm pretty sure, is the desire to rub yourself against somebody else.
See, now I'm going to get an explicit warning on here.
I'm just listen.
Saying, how do we
we're
make
talking
this
pregnancy.
left
You know why? You know
turn?
why we're talking pregnancy? Because people rub each other.
Oh
They rub against each other. It's just, but
that
freterism.
would be the number one cause of pregnancy.
There's a great rubbing of parts, and so
okay.
But
I
but
can take
I'm just
anything,
saying,
but you break it out the accent.
Freterism is when you rub against somebody who doesn't want to be rubbed.
Right.
Against.
That's
So,
that's
anyway,
not
I don't know
normal.
how we got on that, but
Yeah.
in any case, so so
you see what I do?
so we're talking about so bowels, the progesterone. What else does progesterone? Does it do anything to the bladder? Because women have a lot of bladder stuff. Like they have to pee all the time.
Oh,
Yeah.
absolutely. And that's as much progesterone as it is the baby laying against the bladder as well. Because there's much more space occupied in the pelvis with the baby. You have less space for your bladder to fill. You can't hold as much urine as you did before. And you're getting more and more stimulus in order to urinate. And you do, and you feel like you pee all the time, and you pee so much, and it's just your bladder's not filling all the way like it used to and allowing you to hold that. In addition to that, what's really interesting is your kidneys. Your kidneys go through this big change to make more and more urine. The kidneys actually start to filtrate or pass out the water and the toxins at a much faster rate than a non-pregnant woman does. And that's why in pregnancy you may need to drink 12, 15 bottles of water when before you could get away with 8 just to stay well hydrated.
Mm-hmm.
You want to make sure your pee is clear to light yellow throughout the whole pregnancy because it's going to make things a little bit easier when you're not dehydrated. But you're fighting against your kidneys, which are really passing that water through you faster and faster and faster throughout the pregnancy.
So having to pee all the time, normal. What would be something that has to do with the bladder that would be worrisome? I mean, when would somebody, and let's talk about the bowels too. You know, because frankly, you know, like you're saying, constipation, diarrhea, odoriferous gassiness. You know, when should somebody worry about something? And when should they talk to their doctor?
So anytime that you're concerned in pregnancy about something, I always tell every one of my patients, no matter what your concern is, bring it up to me. Let me know what's going on and tell me about it. Even if it's normal, I'd rather hear about something that's normal 100 times and tell you everything's fine than you say, oh, I guess that's fine, and I just won't say anything when it could be a problem. So as far as the bowels are concerned, it sort of depends on sort of what your change is and how frequently you're changing from constipation to diarrhea back and forth. If you're having constant diarrhea, you're starting to have mucus in your stool, you're having blood in your stool. Those are all the number one things that we want to know about and make sure that we start to investigate those reasons. Now, you can absolutely have hemorrhoids because of the constipation, so you may get some blood in your stool, but it's still important for you to let us know, even if it is from a benign condition like hemorrhoids, for us to evaluate that and make sure it is a normal, healthy, or benign condition that could be causing that issue. As far as your bladder goes, we worry about infection. So all the same symptoms of urinary tract infections that you get outside of pregnancy, you get the same ones during pregnancy as well. So burning when you pee, even more increased frequency, strong odor to your urine, all those different changes of urinary tract infections we want to know, because bacteria has a very high propensity in pregnancy to crawl up that urinary tract and crawl into the kidney. And that's why it's
Which is not good.
No, absolutely not. And we have to wind up admitting you to the hospital if that happens for IV antibiotics, especially in pregnancy. So it's why when we hear about a urinary tract in pregnancy, urinary tract infection, I should say, we want to make sure that we treat it right away.
Okay, so what about the increase in mucus and snot and stuffiness? What's going on there? Twila, you didn't chime in yet. You've
Well, I always had that, but that was because I probably ate like my weight in cheese all the time too.
but now that you're a vegan, that doesn't happen anymore because your microbiome is all.
Yeah. Well, no, I mean, I do have a question about that because, like, does it?
Are you talking about biomes now?
No, I'm actually talking about sort of like because for me, mucus and stuff was always a byproduct of allergies.
Mm-hmm.
Do you see like severe changes in allergies during pregnancy?
Interesting question, Twila.
And I have a part 2 to the question. But
okay. So as far as allergies go, the seasonal allergies, usually in pregnancy they get a little bit worse. Can go a little bit sometimes hand in hand with asthma. Patients with asthma have we call it the 1/3 rule, that 1/3 get better, 1/3 get worse, and 1/3 stay the same.
Okay.
Can't pay too much for that kind of advice.
Right.
That's why you're doctors.
There's a few things in pregnancy that kind of has that rule. Your allergies. I've frequently seen people getting more congestion, which yet again is another progesterone byproduct that causes you to have increased mucus throughout your entire body, which is why you can have runny noses, stuffed up. You can also have increased vaginal discharge, which is another common issue in pregnancy. And that increase in discharge is completely normal. As long as it's not a copious amount of clear fluid pouring out, that discharge is usually normal.
Okay.
And there's not burning or itching. Or
right,
anything.
exactly.
Right. What about, say, like skin allergies? Like I had eczema as a child. It went away at puberty, and then it recurred when I got
really?
Yeah, well, and as a matter of fact, it didn't recur in the way it did before. I actually wound up developing it on like the palms of my hands, and it's
that's
now,
syphilis.
Yeah, thanks.
That's tertiary syphilis.
Yeah,
Twila.
thanks. No, I mean it was something I hadn't seen.
I'm kidding.
Yeah,
I'm
I know he really is. I'm
kidding.
laughing at him. No, I mean I had it. I got it at the traditional points, like the joints. But after I was done being pregnant, I developed it on my hands, and now it's kind of just permanent. It kind of shows up seasonally, and it only shows up seasonally. But it wasn't something that occurred before then, and everybody kind of pointed to, well, that sometimes can happen when you're pregnant, and depending on like if you have more kids, it kind of increases other things, kind of like skin tags and things show up.
So in pregnancy, some of the patients who have previous minor skin conditions such as eczema can actually get an increase or flare of them. Some of the more concerning skin conditions, I guess concerning is a word. For example, psoriasis. Actually, psoriasis gets better in pregnancy.
Oh.
And different skin conditions are a little bit different depending on what they are. Some get better, some get worse. It also sort of depends on what they are. But if you are getting a new rash in pregnancy, absolutely go see your doctor. Make sure it is a benign rash and is not something that we should be doing biopsies of to put you on steroids for, because there are some rashes that can be very concerning in pregnancy.
Oh, I hadn't heard of that either.
So basically, Twila, we don't know what happened with your hands. I'm just going to say that. I'm just going to say this. And
I am just
Dr.
a
Bigus
wonderful enigma.
I'm just going to throw this. I have a category that I just weird things of pregnancies. You just got to figure out what's a problem, what's not.
Well, you just kind of
that's weird.
Yeah, you just gauge it. It can be weird, but as long as I can live my life, I'm fine.
So have you ever noticed? I'm just going to throw. I've talked to a few other OBGYNs about this, but have you ever noticed that sometime in the mid 30 weeks that women will sometimes get this pain in their skin and the right upper abdomen? Have you ever noticed that?
What? Are you just making that up?
I am not making it. I'm just saying it has nothing to do with anything. They will point to their right upper abdomen and say, I have pain right here.
I just figured it was the kid in there clawing at you.
Well, I don't know. This is what I tell them. I think, well, it's either I'm just saying that there's never anything else bad going on. There's no other. It's not like it's a gallbladder or anything horrible. They'll just say it hurts right there. They'll take their finger and their point right there.
Is it maybe like a muscle spasm or something?
And so this is what I tell them, for what's worst. I don't know. But I know it's not bad. No, I think it's either skin stretching, like maybe irritation of the nerve, or maybe it is the baby kind of poking out. Yeah. But it's always
could be the ribs stretching too to accommodate.
Oh yeah.
Oh. All right. So, have you ever heard of any issues with sleep, Dr. Bigus, in terms of women who are pregnant?
Who sleeps?
Yeah, right.
Who sleeps when you're pregnant?
That's totally true. Most people have very difficult time sleeping. Couple reasons. Number one, sometimes they have a trouble getting blood back to their heart, depending on the way that they lay down.
Mm-hmm.
Women who lay on their back while they're pregnant, when they sleep, will oftentimes kind of get a hard time feeling like they're catching their breath, get a little short of breath, get a little lightheaded when they lay directly on their back. And this is not a progesterone-related effect, but it's actually an anatomical issue. Once the uterus gets bigger and the baby gets larger, it starts to lay on your spine. Right next to your spine are the two large vessels running right down the middle is the aorta, which pumps the red oxygenated blood to your body. And right next to it, on your right-hand side, is the vena cava, which is the large vein that returns all the blood from your uterus, your lower limbs, and your pelvis back up to your heart to recirculate and pump back out. And when women lay directly on their back, the uterus and the baby compress that vena cava and don't allow the blood to return back to the heart to get reoxygenated and return back to the body. When you do that, you get lightheaded, you get a little hypotensive, your blood pressure drops, and you have a real hard time sort of staying awake, staying alert. So we often ask women to lay on their left side. By laying on your left side, that kind of rolls the baby off of that vena cava and allows you to have good blood return back to the heart to help perfuse the rest of your body.
Okay, so with my second baby, my husband gave me a pregnancy massage, which was a lovely gesture.
Mm-hmm.
And they had one of those great round tables with the big hole cut out of it.
Mm-hmm.
So you could actually lay flat.
Mm-hmm.
Okay, are those bad to actually use? Or is it okay to use
a massage table with a hole in the middle?
Yeah, so your belly fit in the table right in the center, and then you could actually lay flat so they could actually massage you. But it was like the only time in any of my pregnancies I got any sleep. And the lady knew, like, she had other people come in for massages before, and she goes, "You can be as comfortable as you want. You don't even have to talk to me. I know that this is a tough time when you're growing a person. If you want to go to sleep." And I went to sleep for like an hour and a half.
Uh-huh. I can't see anything wrong with that.
I can't either. I'm trying to think. I've never heard of a study about that. It almost sounds like kind of an interesting study.
We always say we're studying. We should get in on the study business.
Yeah,
I say
physiologic changes. Sleeping in a massage table with a hole in it.
Because I remember I remember doing the left hand thing, and it was really difficult because in my normal life I either slept on my stomach or on my right hand side, so it was very hard to stay on the left and kind of get adjusted to it. And I carried a lot of weight, so being on my back was just not an option. But I distinctly remember that particular time on that massage table was like manna from heaven. It was the best.
I don't know how the 7 billion people on this planet were born when these women didn't know how to sleep. We're always telling people to sleep on their sides. And what did I can tell you that 6.9999 billion of those women on this planet did not have any instruction how to sleep.
No, but they have instinct.
Yeah.
And we probably just followed that.
Yeah. So we're going to have to. We need to close this down. We could keep talking about this for hours. I am going to say that if you go to our Facebook group, if you go to the Facebook group too, we would love your comments.
Let us know if you
this.
have. Once the episode airs, we'll put a little link up, so if people have more questions or things that we didn't get to that they're curious about, we'll do a part 2.
Yeah, exactly. Because this is there's so much. I've heard people talking about changes in their sense of taste, metallic, sensations in their mouth, and
vision changes, having to not wear glasses anymore.
Vision changes,
that
weird,
been nice.
Weird dreams. Wacky dreams. So
I want to talk about the foot size thing eventually. How your dog
never
recover.
Yeah, I don't think the foot size ever really goes back.
Nope, it doesn't. I was not happy about that.
So after you hear this podcast, and if you are a member of the Facebook group, please let us know if you have other weird sensations or things that you want to comment about. We'll get on the Facebook group, and maybe we'll even get Dr. Bigus to talk about it or answer it.
Yeah, we'll have another episode.
Kind of fascinating stuff about. As Dr. Bigus was saying, it's a fantastic transformation.
I will say this. One, Dr. Bigus, you did a great job of breaking down this information in a really understandable way from the biological perspective. I've had 3 kids, and a lot of what you said today, I never knew that was why things happened the way that they happened. So I really appreciate that. And too, I love the idea that we're talking about this because it's the one thing that all new moms say to other moms is, why didn't you tell me this?
Yeah.
And we always tell the same lie. Like, if we told you, you wouldn't join the club. Ha, ha, ha. But it really is the only resource we tend to have for this information, because sometimes we're too stubborn to ask, or we think we should be able to, gut it out and get through it, without asking for help, is our books like, What to Expect, where we just kind of scroll through. We don't ever think to, ask the doctors. We never think to ask for very specific information. Some people really don't want it, but some people really do want all of the sort of nitty gritty details so they know what they're walking into. And I think this particular podcast will be really helpful.
Yeah. So before we go, I want to encourage people, if you're listening and you're not a member of the GynoCast Facebook group, please join.
Yes.
So easy. Just go to Facebook, search the GynoCast, and
Ask to join.
Ask to join.
Private
and
group.
As long as you're not a predator or a whack job, we'll admit you.
Yeah, the name GynoCast can sometimes bring out the unsavory element because they think it's a place to do shenanigans, and our group is not for that.
No shenanigans here.
Nope.
And what else was I had something else brilliant I was going to say.
Oh, probably about the discussions and all the good stuff we have there.
We have all that stuff there, exactly. And
as always, for this episode, we'll have a syllabus. It'll be up at the website at matriarchdm.com. And so we'll have links and resources to some of the information
that's what I was going to say.
that Dr. Bigus was talking about.
If you want more information on Bigus.
Absolutely, how to reach him and how to get more information about today's topic. We'll have that all there as well.
All right.
Very good.
Thanks for listening. Dr. Bigus, thank you for joining us. Twila Dang, thank you as always. See you soon.